I'm thrilled that we now have really advanced surgical simulators. These systems enable us to educate younger colleagues in cataract surgery, but also level up the performance of advanced surgeons because they now can train really rare conditions, complications, which they're usually not faced to. This definitely will lead to better patient care. With the increase in world population as well as life expectancy, we're really running into a problem. Now, with the surgical simulators, we have a unique opportunity and chance to train more younger surgeons before they go to the patients, but also do it faster and also provide this service to rural areas, which gives us a broader scale worldwide to attack the main cause of blindness, cataract.